we're rolling. We've got numbers for your follow-up. First, my friend, how'd you do overnight?
I did good.
Okay, and I see your dressing looks like you changed it out. So you put your own on?
Yes.
Okay, so you had your wife do it, or you had your girlfriend?
My sister, yes.
Your sister. He's got so many women in his life.
Right?
It's amazing. Wow, okay, I don't know how to keep them all straight. That's amazing. So, did you have a lot of pain?
No.
You took the pain pills?
Yes.
Okay, good. All right, so Gumby Jean's going to come and remove this dressing here in a moment and remove the packing. And then what we're going to do is we're going to squirt a little bit of lidocaine in there, a little numbing medicine, because we do need to repack this, okay?
Okay.
Now, did you have any fevers or chills overnight?
No.
All right, good deal. She'll be with you in just a moment. It's us.
Hey guys!
We're doing the work. Actually, you're going to do the work on this one.
He's making me do the work,
Yeah, but you like it.
which is fine. Because I really do like it.
It's fine. All right. Okay. Well, we're rolling then. So I'm just the videographer right now.
Alright, so I'm gonna take the dressing off.
Ooh. So a little bit bloody.
Okay, so I'm gonna, on the count to 3, take a deep breath.
She tricked you, didn't she? That was
Oh,
a lot of
wow.
packing, wasn't it?
You okay?
Yes.
It looked like a giant worm that came out of there.
I thought it wasn't gonna stop coming.
Okay, now she's going to squirt some lidocaine in. There you go, get that tip down in there. Yeah. Nice and slow. Perfect. Okay, we'll give this a couple minutes or so to work, and then we'll come back and put the packing in. Okay, so now we're going to replace the iodoform gauze. There you go, right in there. Just let me know if she causes you any pain, okay? I'll give her, I don't have to move around. Come over here
In
so
the
I
way?
can see, yeah. Go.
Are you feeling any pain?
Just slightly.
Little bit.
Just a little bit. But it's okay.
Yeah, yesterday he was screaming at me. You didn't give me any pain medicine.
Well, he really wasn't having pain when he came in before. He just had the infection. So we gave him, of course, you did give him a big shot. I think that's really what he was
Seven.
mostly upset about, yeah, the Ceftriax. And so there's that, you know. So the reason we're packing, so everybody knows, is we want this wound to heal from the inside out. We don't want this wound to close up because it's been infected. And if it closes back up, then there's a good likelihood that the infection will return and the abscess will reform, and we'll have to, of course, drain it again, which is not what numbers wants at all, is it?
No.
No. Did you see that silver unicorn just drop? See, it's the winged Pegasus, right? I think numbers took some pain medicine. I guess is what I'm getting at here.
Right? Did you
Yeah.
take some before you came?
I'm falling asleep here.
I think he's really relaxed.
Yeah.
He might be enjoying the experience.
Right?
Just a little bit.
You know what? That's okay. That's what they're there for. As long as you've got a ride home, we're okay.
Yeah.
You're doing a great job, Gumby Jeannie.
I've seen you do it enough.
You're a natural. Push it all the way in. If you're going to push down hard, though, ask him to take a deep breath, because
Okay.
it might be a little uncomfortable.
Deep breath. I'm almost done.
She is almost done. We're getting to the end of the ribbon. Put about 3 foot of that stuff in. Maybe 2.5. Fabulous. Wonderful. Okay, so we're going to put a clear plastic dressing over it like we did before.
Mm-hmm.
And let's see, this is Tuesday. We want you back on Thursday this time, okay?
Is Friday okay?
Yes, Friday will be fine. Let's get one more little close-up here. Okay. You're doing awesome, numbers. Thanks.
All right, thank you.
Hey folks, you spoke and we listened. Here's what you had to say about Meta 7.
I love it so much. It gives me so much energy during the day. I've noticed a change in my hair, my nails, my blood pressure.
There's no doubt that it's a benefit to me. It gives me more stamina.
And it could actually help you lose weight.
Now, I haven't taken a nap in 6 months.
That's right, Meta 7. More and more people are sending in their testimonials. Weight loss, more energy, and generally feeling more alert during the day. Let's hear more.
I used it to help wean myself off caffeine and energy drinks, and my productivity has been very high lately.
It's natural, it's amazing. I feel motivated to get out and do things that I didn't before.
I'm not tired during the day. I've worked 12-hour shifts.
Just go, go, go all day. It makes me feel great. I love it. And take it. It's wonderful stuff.
If you haven't tried Meta 7 yet, it's time to order yours from Amazon. Time to boost your metabolism and kick your energy level into high gear. There's an Amazon link in the description.